What happens when you hold your pee in for too long? Welcome to Optimus Health Channel. Today, we're going to talk about what happens when you hold your pee in for too long. The dangers of holding in your pee for too long. Holding your pee for too long can lead to a lot of health issues. This is because the bladder starts to fill up and the pressure on the bladder wall increases, which can cause pain. Holding your pee in for too long also means that you may be drinking less water, which can lead to dehydration. The reason why we feel this pressure is because of the muscle spasms in our pelvic floor muscles and bladder wall. These muscles are usually relaxed when we pee, but when they stay contracted for a prolonged period of time, it leads to these symptoms. Constipation and bladder contractions are also associated with pelvic floor muscle spasms. How long does it typically take for the pain to go away? The bladder will become enlarged and will be unable to store any more urine, leading to an increase in frequency of urinating or a feeling that you need to go more often than usual. This can also lead to urinary tract infections. The ovaries and fallopian tubes are the major female organs that produce eggs. These become enlarged with swelling, which can lead to problems during pregnancy. There may also be an increase in vaginal discharge or a change in the color of the fluid. Generally, going to the bathroom when you feel the urge will help avoid these issues. Why it's important to drink lots of water and avoid holding it in for too long. It is said that the average person will hold their pee for about 5 minutes before using a bathroom. This can become a habit, and many people find themselves not going to the bathroom when they need to. If you do this too often, it can have negative effects on your bladder, kidneys, and other parts of your body. It's important to drink lots of water and avoid holding it in for too long because it can lead to some health problems. Drinking plenty of water helps keep your body healthy. It can help you stay energized, lose weight, feel better, and make your skin look healthier. It's also important to avoid holding in pee for too long because it can lead to some health problems. Holding in pee for too long may lead to urinary tract infections, bladder infections, or kidney infections. Negative effects that can occur when you hold your pee in too long. The bladder is a muscular organ that is located in the lower abdomen. It stores urine and releases it when the body needs to get rid of it. The bladder is usually able to hold a lot of urine, but if you don't go to the bathroom when you need to, it can lead to some negative effects. If you hold your pee in too long, your bladder may become overstretched and irritated. This can lead to urinary tract infections or kidney problems. Holding your pee in too long can also lead to incontinence or increased frequency of urinating. Though it's perfectly normal to feel the onset of an urge to urinate, you shouldn't wait until you feel the need to go. You should also not hold your pee in for more than 30 minutes. Urinary tract infections that can occur when you hold your pee in too long. Holding your pee in too long can cause a urinary tract infection. Your bladder and urethra are connected through an opening called the urethral meatus. Keeping urine in the bladder for a long period of time may cause bacteria to collect, which can lead to an infection. Avoid this by going more often and not holding your pee for hours at a time. It's a good idea to drink enough water throughout the day to keep your urine dilute. Limit your caffeine intake and alcohol intake. Avoid drinking too much soda and caffeinated drinks, as those can lead to dehydration. Kidney problems can occur when you hold your pee in too long. When you have to go to the bathroom but you hold in your pee too long, this can cause kidney problems and kidney stones. When you hold in your pee too long, it can cause kidney problems and kidney stones. The kidneys filter out waste from the body through urine. When the kidneys are working hard to filter, they can become overworked and may eventually develop a stone that blocks urine flow. If you drink too much water to prevent dehydration, you can actually cause a kidney stone. When your kidneys become overworked, they may not be able to filter waste out as well as they should, and the waste builds up in the body. As this happens, it may irritate the bladder and make it more likely that straining while urinating will lead to the formation of a small stone. Incontinence occurs when you hold your pee in too long. Incontinence is a common condition for the elderly that can lead to a variety of problems. When someone constantly holds their pee in too long, the bladder muscles can weaken and cause more frequent episodes of incontinence. The increased need to go to the bathroom can lead to bladder infections and less time spent enjoying life. Most people don't realize that incontinence can happen at any age or stage of life. The bladder is a muscle, and if you don't use it, it will atrophy and stop working. If you can't go to the bathroom when you want to, it can lead to urinary tract infections and other complications. That if you hold your pee in for too long, you may be more likely to develop a range of other medical conditions such as diabetes, obesity, and heart disease. We all know that drinking water makes the body feel better, but it also helps keep our bladder in check too. How long should you hold it in for if you can't make it to the bathroom? If you can't make it to the bathroom, how long should you hold it in for? This is a question that many people have been asking themselves. There's an age-old argument of whether or not holding it in for a few minutes will do any harm. Others argue that if you're holding it in, your bladder can rupture and cause serious damage to your kidneys. So what is the answer? There's no definitive answer to this question, but there are certain guidelines that will help to keep your bladder healthy. The American Urological Association recommends urinating at least every 2 hours when possible and urges people who are unable to do so to drink plenty of water. The first step in managing your bladder is learning how long you should hold it in for if you can't make it to the bathroom. The average person should be able to hold their urine for 2 to 3 hours without any problems. If you are not sure how long you should be able to hold it, experiment with different times and see what works best for your body. If holding your urine is causing discomfort or pain, then try peeing in a cup or other container as soon as possible so that when you go pee again, there will be less pressure on your bladder and urethra. Thanks for watching. Don't forget to check out our other videos in the channel and subscribe to be part of the family. Turn on notifications so you don't miss anything. Remember, stay strong and live long. I'll see you in the next video.